Hi guys, it's Tara Scott from Revitalize, and I read this article in OBGYN Management in September of 2017 that talked about the risks of combination oral contraceptives with a synthetic estrogen and synthetic progestin, and it was examining the link to cancer. So basically they looked at 4 types of cancer: cervical, uterine, ovarian, and breast, the cancers that affect women. And what we've known for a long time is that ovarian cancer and uterine cancer are decreased with the use of birth control pills. So it actually protects you from that. But what these studies said is 3 separate studies showed an increased risk of breast cancer with the use of birth control pills. Now, after 10 years of getting off of birth control pills, that risk does decrease, but the longer you take these birth control pills, the risk of breast cancer goes up. And the finding that surprised me the most, I think, is that there was an increased risk of cervical cancer the longer you took the birth control pills. So that risk increased after 5 years, and after 10 years of use, it was almost 4 times as much. Now we know that cervical cancer has a link to HPV. So even extrapolating that in HPV users, there was still an increased risk of cervical cancer. So decrease in ovarian and uterine, but increase in breast and cervical. So I think these are very important in assessing your decision on whether or not to take oral contraceptives. My analysis is, if you need birth control, you could take birth control pills for a short time, but when you're done with your family, think about a more permanent type of birth control. If you need cycle control, birth control pills may not be the right option for you. And I see this a lot in young girls with heavy periods, or even women in their 40s who've already had their tubes tied, who get put back on birth control pills when their periods start going crazy. So I would say it's good for birth control for a short period of time, but not for a long period of time. And if you have cycle problems, then maybe get to the root cause of what's going on and treat the hormonal abnormality. Because even though uterine and ovarian is decreased, breast and cervical are increased. And I just think you shouldn't increase your risk of cancer at all.